Global Business Power has become the leading power producer in the Visayas, with the flexibility to supply base, intermediate, peak load, and ancillary support, responding to the growing energy needs of a dynamic nation connecting businesses and communities. We provide programs addressing health, education, environment, and the social development needs of the communities around us. Our vision is to be the leading and most efficient energy provider in the country. What happens when we generate power? We enlighten lives. We empower progress. We are Global Business Power.
Let's do it one more time, yeah. Ah, here we go again. Oh, 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 oh. All I know is that the grease gets better when the skillet's hot, the dish sticks together. You say the cooking's done, but it never ends. Oh, 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 oh. Oh, here we go again, yeah. Oh, here we go again. One more time, yeah. Oh, here we go again.
Global Business Power has become the leading power producer in the Visayas, with the flexibility to supply base, intermediate, peak load, and ancillary support, responding to the growing energy needs of a dynamic nation connecting businesses and communities. We provide programs addressing health, education, environment, and the social development needs of the communities around us. Our vision is to be the leading and most efficient energy provider in the country. What happens when we generate power? We enlighten lives. We empower progress. We are Global Business Power.
Welcome to the Daily Garden documentaries, where the longest stories is given. Welcome to Caffeinated, Daily Garden's podcast series in partnership with Ubra Shared Space in Cafe.
Oh, here we go again, yeah. Oh, here we go again. Let's do it one more time, yeah. Oh, here we go again. Oh, 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 oh. All I know is that the grease gets better when the skillet's hot.
Yes. Senate. Good afternoon, everyone. Maayong hapon sa inyong tanan. I am Francis Hentoral, and I will be your moderator for today's session. On behalf of the Iloilo Business Club and the Daily Guardian, I would like to welcome everyone to today's Iloilo Business Online, a webinar on the topic, National Strategies to Accelerate Economic Recovery from Impacts of the COVID-19 Pandemic. This is with Secretary Carl Kendrick Choa of the National Economic and Development Authority. As a background, the Philippines reported its first COVID-19 case on January 30, 2020, and confirmed its first coronavirus-related fatality 3 days after. The country was officially placed under a state of calamity for a period of 6 months on March 17, 2020, mandating national and local authorities to mobilize resources needed to respond to the health crisis. The state of calamity was extended for additional 12 months in September 2020, facilitating one of the world's longest and most stringent lockdowns. In March and September 2020, the government passed two wide-ranging stimulus packages aimed at helping to mitigate the economic impact of the crisis and aid in the health response. Following a difficult 2020 for the country, Iloilo Business Online would like to know the country's economic performance in the 2020 and the significant economic trends and prospects this 2021. On a national level, we would like to be updated on the Philippine National Development Plan, especially on the strategies, measures, policies, and budgets to cushion the effect of the pandemic in the Philippines. On the regional front, we would like to know about the status of the big ticket projects in Western Visayas like the Panay-Guimaras Negros Bridge. This webinar, therefore, is organized by the Iloilo Business Club with its main partner, the Daily Guardian, and supported by the Global Business Power Corporation. On behalf of the IBC and its partners, I would like, therefore, to thank everyone for their participation in the past advocacy webinar series. Your presence today inspires us, and we are very grateful for your participation and support. I am certain that this webinar will be an insightful session for everyone. But before we proceed to the webinar proper, Iloilo Business Club would like to welcome everyone through an opening remarks to be given by its chairman, Mr. Juan Jose Zamora III. Chairman Zamora, please. We would love to hear Chairman Zamora. Maybe the technical team can review. Can the technical team repeat the opening remarks, please? Sorry for the technical difficulty. Maybe we can request the technical team to repeat the opening remarks. Record. Okay. I, I, I understand we have some technical difficulties, but this would not prevent us from continuing our session this afternoon. The biggest claim we heard so far in framing our national recovery plan is that there is always a trade-off between public health and the economy. This viewpoint is always summarized in a slide showing a weighing scale provided by our NEDA chief and socioeconomic planning director, Carl Kendrick Chua, in his various press briefings. This weighing scale is supposed to show a cost-benefit analysis of imposing stricter quarantine measures. On one hand, you have the benefits of lockdown, including the prevention of new cases and deaths of COVID-19. On the other hand, there are costs such as hunger, unemployment, income loss, as well as death arising from non-COVID diseases. We really wanted to learn more about the state of our national economy during this pandemic, using this particular weighing scale that our good secretary always uses in his presentation. We would like to know more about the challenges we are facing and the plans to address the measures to mitigate these challenges as a result of the impacts of COVID-19 pandemic and other risks. And of course, the best person to talk about this is no other than Secretary Carl Kendrick Chua of the National Economic and Development Authority. As an introduction, Secretary Chua became acting secretary of NEDA on April 20, 2020. Tatlong 20, no? 2020. His top priorities upon being appointed as a secretary and secretary general amid the COVID-19 crisis include fast-tracking the national ID system, the economic recovery plan, and the Build program. Prior to his appointment, he was the Undersecretary for the Strategy, Economics, and Results Group of the Department of Finance. In his capacity, he helped the government implement its 10-point socioeconomic agenda by ensuring equitable and sustainable financing through the Comprehensive Tax Reform Program. During his tenure in the Department of Finance, he led the tax reform team to work with Congress to pass the Tax Reform for Acceleration and Inclusion Law, or popularly we call TRAIN Law, which corrected the long-term inequity of the tax system by reducing the income tax rates while at the same time providing for the government's Build infrastructure program. Then Undersecretary Chua was very critical in the passage of the 3 pieces of legislation increasing excise taxes on seen products such as tobacco, alcohol, e-cigarettes to actually fund the Universal Healthcare Program. Prior to joining the government, he was the World Bank's senior country economist for the Philippines. In his capacity, he advised the government on strategies and policies to attain more inclusive growth, the type that creates more and better jobs and reduces poverty. In his last 2 years in World Bank, he spent 1.5 years working in Mindanao, where he led a team to conduct an in-depth research for the 2016 Mindanao Jobs Report, a comprehensive strategy for the island's group development. The study's inclusive approach integrated the insights of the government, business, labor, civil society, and vulnerable groups who are often left out in the engagement process, such as the indigenous group, the Moro women, the out-of-school youth, combatants, and internally displaced people. He was actually with World Bank for 12 years from 24 to 2016. Acting Secretary Chua completed his MA in Economics in 2003 and PhD in Economics in 2011 at the University of the Philippines School of Economics. Of course, prior to joining the World Bank, he was an assistant professoral lecturer of mathematics and economics at the Ateneo de Manila University, where he completed his BS in management engineering in 2000. He was a consultant for several local and development partner-funded projects in the area of economic and fiscal policy. He was named one of the 10 outstanding young men and women in January 2019 by the Junior Chamber International Philippines. He is married with one child, and his hobby is astronomy, the reason why he named his little boy after a star kid. Ladies and gentlemen, please join me in welcoming our Secretary Carl Hendrik Chua of the National Economic and Development Authority. Mr. Secretary.
Thank you very much. Can you hear me, Francis? Thank you
Yeah,
very much for the
very-
introduction. Thank you very much to the Iloilo Business Club, to your chairman, Chairman Amora, for the invitation. I am very happy to be here. Mayong hapon po sa lahat. I will just pull up my PowerPoint. Usually, I prepare presentations and I use them for several occasions. This group is special because you are looking at fresh new slides, and the succeeding groups after you will be looking at the same slides. So that is something special for your group. And my presentation today will focus on understanding the recent spike in COVID-19 cases, the heightened quarantine in the NCR region, it is ECQ again, and the impact on the economy and the people. I will discuss 5 areas: development story, then our recent development, the impact on the economy, the impact on the people, and our recommendation, which is to manage risk, implement the recovery program, and accelerate the vaccine deployment. Before I start, I always tell all my audience, there are 2 economic principles that you must memorize, dream about, and apply. Because if you don't understand them, it is hard to understand the actions of government. The first is, nothing is free from heaven. The second is, everything is a trade-off. You know, some people think that they are entitled to some freebie, incentive, exemption, subsidy, or allowance, and that the government probably has an infinite source of all these. But the truth is, nothing is free from heaven. If I give a subsidy, I have to find a way to finance it, either through taxes you pay today or taxes your children or grandchildren will have to pay if we borrow the money. The second is, there's no perfect solution. Everything is a trade-off. And later I will show you one of the biggest trade-offs that government makes. Whether we save lives from COVID or lives from hunger and other diseases. If I give one group a subsidy, I am taking that from another group. If I give Luzon more budget for infrastructure, I'm taking that away from Visayas or Mindanao because I have a finite resource. I have finite budget. You are all businessmen or head of your households, and you know you have to work within the budget. If you want to watch more videos, you cannot have more than 24 hours. You have to cut your sleep, your work, or your intake of food. So with that, let me now go to the development story of the Philippines. When the Duterte administration started office, we had one vision. By 2022, we would reduce poverty from 21.6% of the population to 14%. In other words, we want 6 million Filipinos lifted out of the poverty. And the poverty line at that time, on average, was 60 pesos per person per day. And our other vision is that we increase our gross national income to at least 3,966 US dollars per year on average per person, so that we become upper middle income country status like Thailand and China today. And in 24 years later, at the time that was 2016, we would reduce our poverty, rather eradicate extreme poverty, and become a high income country like Japan and South Korea. So that is the vision. And everything we do is supposed to achieve that vision. And we have done a lot. In fact, in 2020, or rather 2018, the 2022 promise of lifting 6 million Filipinos out of poverty was achieved in 2018, 4 years ahead of our schedule. The Philippine Statistics Authority recalculated poverty and found it to be higher at 23.5% of the population in 2015. But in 2018, when they did the survey again, they found out that poverty fell to 16.7%. That means we already lifted 6 million Filipinos out of poverty. We have achieved the goal. And we are still aiming for 14% or lower. And the reason why we are able to do this is we were focused on delivering the 10-point socio-economic agenda, which the Duterte government committed at the start of the administration. All the greens that you see have been achieved during the first half of the term, and we are working on the few yellow ones by next year. I will not go to the details, but we have done a broad range of reforms to set the standards of living at a better footing. And when we entered COVID, we had one of the most successful economies in the world. Now, what happened? Recent developments. Well, we saw in March or February 2020 the beginning of COVID-19. And this is the daily case rate for the entire country. We started with 0 and we ended up with more than 10,000 cases per day. The good news here is we were able to contain it in separate occasions. From the peak in August, we were able to reduce it for the next 6 consecutive months. That is why we reopened the economy last October 12. And during Christmas vacation, we did not see a spike. However, with the new variants, with quarantine fatigue, with some false hope that the vaccine will give you protection, we are seeing the spike today, and we have to be very careful. At the same time, the color-coded bars that you see at the bottom shows the extent of our quarantine, and it is one of the longest, broadest, and deepest quarantine in the world. That is why it has an impact on the economy. In Region 6, where you are lucky to have the cases much more controlled, but you are also seeing, like the rest of the country, an increase in the number of cases. So I would advise heightened caution, even if you are not in ECQ, because you don't want to get to that level. It is of great difficulty to be in ECQ. Now, the good news is the far majority of cases are either asymptomatic, mild, or moderate. Most of them can get well at home, and this is viral. The doctor will advise you to rest, boost your immunity, and drink a lot of water. We are concerned, of course, about the 1.1 severe and critical case that are at risk of dying. In Region 6, your total cases are far lower and your active cases are more manageable. And you also reflect the national average. But again, take care and abide by the health standards, because we don't want this to get worse. We want it actually to be better. Now, the impact on the economy. Gross domestic product fell full year by 9.5%. This is a measure of economic performance. The first 4 years of the Duterte administration, we had solid growth of around 6%. And that is one of the fastest in the world. for our level of development. But in 2020, it collapsed to as low as minus 16.9%. It gradually improved, but we are still far from positive. And that is the lowest GDP or gross domestic product growth rate since 1947. Last year, we lost 1.04 trillion pesos in total income or wages to households, or an average of 2.8 billion pesos per day of foregone wages. And on average, each person lose 23,000 pesos per year. But some workers lose far more because they have lost their jobs completely and are harder hit. And one reason for this is we are unable to get people to work. Public transportation is down by 50% because of the one seat apart. The way to interpret this graph is starting from February last year, where we were at 0, or the normal public transport visit in the station as measured by your location when you bring your smartphone, collapsed to minus 80%, improved to minus 40%. That was around Christmas because everyone wanted to go out and buy something. But it went down to minus 50%. And we have been there for the last 3 or 4 months. And we need to expand route, expand frequency, and support active transport like bike lane network. And that is how people can get to work. That is one of the major recommendations of NEDA. Now, people actually going to work, we have seen it improve, but we are still down by 25%. That means a lot of people still cannot go out and work, particularly in the GCQ area. And if the children are not allowed to go out, then the families do not go out. And that is a major source of spending and driver of consumption in this economy. Now, let's look at the impact on the people. The main message of this slide is that employment responds directly to the quarantine. So look at NCR, that the red bar. The unemployment rate was a low of 4.8% prior to the pandemic, went as high as 15.8%, but gradually improved to 8.8% as we shift from ECQ to GCQ. But because now we are entering another ECQ, that might get worse. But still, prior to the present ECQ, NCR has 300,000 more people that are unemployed, that should be unemployed. Now, outside NCR, the areas AONCR or areas outside NCR, notice that from a low of 4.6%, it went up to 18.5%. But because the provinces, including your region, opened up faster because you are in MGCQ, notice that your unemployment rate fell immediately to 9.1% and then to 8.2%. Unfortunately, we are seeing a slight increase at 8.7%. But the main story here is that the opening of the economy or the level of quarantine restriction has a direct and immediate impact on the jobs of the people. Now, over the months or quarters, rather, employment has gradually increased across sectors. So let's start with January 2020, the green circle. Between January 2020 to April 2020, the red circle, where we had ECQ, we lost 8.7 million jobs. But then when we relaxed a bit, between April to July, GCQ, that orange circle, we recovered 7.5 million jobs. But then from July to October, we lost 1.5 million jobs. We looked at the reason for this, and apparently the main reason for that are two things. Number one, the series of typhoons and flooding that affected several regions. So many people lost their jobs, particularly in agriculture. But also many parents had to stop work because the public school started in October. They had to sit down with their children to do the modules or do online class. But notice from October to January to February, we continuously created jobs. In fact, compared to where we started, we are 0.6 million or 600,000 more jobs than where we started. But of course, we are concerned about the quality of jobs. So not only do we want people to have jobs, We want them to have better jobs. And that is something we have to work on. Now, another concern is that SWS Social Weather Station shows that in NCR, hunger rate is one of the highest at 23% of the population, or 3.2 million hungry people, largely because of GCQ. In the provinces, notice that in areas outside NCR, the blue chart went up to as high as 34%, but when you opened up, you were able to reduce hunger rate by more than half to 14.9%. In other words, people in NCR, where you have your dreams fulfilled, you have the best jobs and opportunities, there are more people hungry because we are in GCQ prior to the present spike, and now we are in ECQ. But in areas such as Iloilo, you are in a lighter form of quarantine and keep it that way, and that is how you reduce the hunger rate at 14.9%. Now, another problem that we have to balance is that many people are foregoing treatment of high burden diseases. This chart of the PhilHealth shows that the claims for high burden diseases have collapsed by 75% because people either are afraid to go to the hospital. There's a long queue in the hospital. When I had to get a treatment or test last January, I had to wait for 2 weeks because they have moved people and nurses to COVID wards. And some people don't have money. And we are concerned that next year, or rather this year, their diseases might get worse. If you have cancer, you cannot just stop your chemotherapy. If you have a heart disease, you cannot just stop the treatment. And across all of these 12 high burden disease, you can see a collapse in PhilHealth claims because people simply have stopped getting treatment. So while we are concerned about COVID patients, we are also concerned about those with asthma, cancer, hypertension, and so on. And many of you who are middle-aged have one of these diseases. And if you are in Manila, it would be quite difficult to get treatment nowadays. We are also concerned about all those deaths outside COVID. Yes, we have thousands of deaths from COVID and pneumonia, the red ones, but the top 10 burden of these deaths are not COVID. They are heart disease, cancer, stroke, and so on. So while we have to be careful about or concerned about COVID patients, we also have to be concerned about all the other patients who need care also. That is why in NEDA, our objective is the holistic development of the person, whether from COVID, from non-COVID, or hunger. We are also concerned about our increasing malnutrition rate. The story here is that you need to have a healthy mother so that the healthy mother will give birth to a healthy child. And the healthy child, because of higher cognitive skills and IQ, will finish K to 12 and enter college and get a good job. However, today, 1 in 3 mothers are malnourished. They will give birth to malnourished children. 1 in 3 children are malnourished, as this slide shows. And they will not finish school because their cognitive skills are not enough. And they will end up in a low-pay, low-skill job. And that is typically passed on to their children. That is why we are concerned about the impact of COVID on so many other things. And finally, we are concerned about the impact of COVID on education. In the PISA score, which is an international standardized way of measuring proficiency in reading, math, and science, the Philippines has one of the lowest score prior to COVID. And if we don't have school open, then you can imagine how many more of people will not get the proper education. So this is the idea, what I want to present to you, that there are many consequences and we have to balance all these trade-offs. Now, let me end with the recommendation. The reality is we will have to live with the virus. It will not go away. It will probably be like flu. It will come back once in a while, even with the vaccine. And like flu, you probably will have to take the vaccine every year. But there are many ways to prevent the virus from affecting your lives. And we have to work together during this critical period. Our prospects for the economy is still strong, given the context we are today. We expect the economy to grow by 6.5 to 7.5%, but already the 2 week of ECQ may reduce this by 0.8. It's too early to say if that will be the case, but it is possible, but we have to catch up and do better. In 2022, we expect a stronger recovery of 8 to 10%. And there are 3 ways to enable our recovery. We have to reopen the economy to MGCQ or better, but at the appropriate time. You know, when I proposed MGCQ last January, February, it was because the data shows that we are ready. But today, the data has changed, and we are only basing our recommendation based on the data. So today, we will not recommend the opening. We will recommend a strict enforcement of the ECQ, but at the appropriate time, given the impact on the other members of society, we will have to gradually open and manage the risk. The second is we implement our recovery package. I'll explain the details later. And the third is to implement our vaccination program. Now, you know, the reality here is if you impose ECQ or GCQ, the analogy is like you are radiating the entire body of a cancer patient when the tumor is localized. So if your tumor is in the prostate or in the breast, you do not radiate the entire body. You know, targeting the source of cancer stands a better chance of healing the person rather than subjecting the entire body and all healthy cells to harmful radiation. That is why we have proposed the following. So we have to heighten the PDITR strategy. It starts with prevent. You wear your mask even at home. If you have elderly or comorbid, you wash your hands, you stay home. And if you're outside to buy essential goods or service or to work, you maintain social distance. From my experience, 95% of the problem is solved if you do it yourself. Then we have to improve contact tracing, preferably automated. Then we have to have better quarantine and isolation facilities so we do not burden the hospital, because we want to reserve the hospital for those with severe cases or critical cases. Then we will be able to recover and we add the vaccination. So that is really what we recommend. To manage the risk, what we have recommended prior to ECQ was localized lockdown. We continue public transport and support bicycles. We continue curfew except for workers. We have only essential travel outside the NCR plus bubble so that we do not spread the virus to Region 6. We reduce capacity in back-end office, but for the others like supermarkets, factories, we should continue to the maximum because we do not want to hamper the production of goods and services. We stop indoor dining, but you can do outdoor dining, al fresco, or takeout or delivery. In fact, prior to COVID, we would eat out 2 or 3 times a week. I still do that, but I always have it delivered. No social gathering, and you wear masks at home and stop visitors from coming. This is really how it works. And this is how we address the problem. Instead of putting the entire region in ECQ, because that only postpones the problem and doesn't address it. This is how you address the virus. Now, the second is we implement the recovery program. We have Bayanihan 1 finished, Bayanihan 2 is extended. You have the create. When you file your income tax for April 15, you will pay as low as 20%. Hopefully that will help. You will also be able to carry your loss for the next few years. We are helping the banks get rid of bad assets so they can lend to you more. We are working on the guide to address solvency problems of firms. We have the Build program, and there are several projects in your region. And we have a 4.5 trillion budget, so we will intend to use it fully. Overall, our 4-pillar strategy to address COVID has a total of 2.57 trillion in various forms, whether it is monetary, financial, fiscal, tax reduction, or support to health. That is 13.8% of our GDP. In other countries, they also don't do just fiscal stimulus. They do a combination. In Indonesia, they do a lot of off-budget or GOCC-led In Malaysia, they also do a lot of off-budget, like pension, using their pension system to support. So when we compare, we should not compare only fiscal. We should not only compare only spending. We should look at the entire picture because that is how we intend to respond to this pandemic. And finally, we will continue our vaccination rollout. We have already placed orders and contracts to cover all the adults, 50 to 70 million Filipinos. We are waiting for the supply to come. And we have a very orderly way of prioritizing. We start with the frontline workers, that is A1. I hope some of you have already started with A2, senior citizen, and A3, people with comorbidity like high burden diseases like cancer or diabetes. Then we will continue until we cover the remaining population. So this is the queue that we will follow. And for many of you businessmen, in A4, all of these workers will be prioritized because you deal a lot with the people face to face, and we don't want you to get sick. So as soon as we finish priority A1, A2, and A3, we will tackle the priority workers. Now, let me add, I started this presentation with the claim that there is no perfect solution. Everything is a trade-off. In the IATF, before we decided on ECQ, we have to do this balancing. By imposing a 2-week ECQ, we would prevent up to 323,262 cases, prevent 6,000 plus deaths, and 9,000 plus severe or critical case that might overwhelm our hospitals. However, we have to be mindful of the cost. Poor people is already 19.7. It will be 102,000 more. So is that something we can live with or not? We have to do the cost benefit. Unemployed, there are already 4.9 million unemployed. This 2 week of ECQ, by the way, you are all in Iloilo, right? But I tell you what, the NCR plus region is 50 or 60% of the economy. And what happens there affects the entire country. Like tourism in Boracay are limited because of the bubble. No, income loss, 2.1 billion pesos per day. Non-COVID deaths, 553,000. And the decline in PhilHealth claims for high burden disease. So all of these we are trying to balance. And if we don't use the ECQ period wisely, it will be useless. And all the suffering of the people will be in vain. That is why our recommendation is not only the ECQ, but using that time to improve our PDI-PR strategy. So 3 more lessons. I would suggest you memorize, dream about, or apply. Know the facts, contribute solutions. Don't stop with what to do. Also focus on how to do, and also share the good news. You have access to social media or your Viber groups. Please be mindful of what you read because from experience, not all are facts. And if you try to spread something that is not true, it is going to be very sad and you are just causing more confusion. So I suggest we all know the facts before we spread it to our friends, especially when we deal with critical ones like which medicine to use. Number 2, contribute solutions. Don't stop with what to do, also focus on how to do it. Many people tell me, or the government, you should do this and that and this and that. But they read from the textbooks. And it's, of course, obvious that during a crisis, you have to pump in more money, give subsidy. The problem is no one told me how to do it. And in a second or third or fourth best world, where people don't have bank accounts, where we don't yet have a national ID, where we have a lot of inefficiency, how do we do it? So I propose to have an intelligent discussion. If you have a brilliant idea, you share with government not only what to do, but how to do it. And finally, also share the good news. Because there are many things that are happening, but like eating in a restaurant, if you are served bad food, you will likely complain. But if you are served good food, you are unlikely to praise the chef all the time. So let me end there. Thank you very much.
Thank you very much, Secretary Chua, for that I may say, a feel-good presentation. We are indeed grateful for your time with us. And I would now like to encourage our participants to ask questions. To those who are joining us in the Zoom, you may ask questions by submitting it through our Q&A button. And to our audience in the Facebook, you can probably send them through by leaving comments on our Facebook Live video. Of course, please don't forget to indicate your business or organization's name and, of course, your name. So we are now ready to invite questions from our participants. And maybe the first question may be thrown by Joseph Marsan of Daily Guardian. Joseph, would you like to state your question verbally?
Yes. Hello. Can you hear me?
Yes, you are
Yes.
clear.
Good afternoon, Secretary Chua. Some economists and economics professors here in the country are suggesting recurring stimulus payments as a form of economic recovery. It's different from those that we have already implemented in our bayanihan laws, such as the DOLE and DSWD programs. Their idea is actually to provide unconditional cash transfers, as we've already done, but this time as an expanded program also to those who have been impacted, heavily impacted and moderately impacted in the current economic situation. They say that it is to induce a circular movement of money. Is the economic team open to this kind of suggestion? Why or why not?
Well, first of all, we already have Bayanihan 1, Bayanihan 2, and the entire 2021 budget is designed to support the people, 4.506 trillion pesos. In that budget, there are 284 billion peso worth of subsidy. So, and then we added another 23 billion to those affected by ECQ. So all of those, I believe, should be prioritized and used before we consider any more further stimulus payment. On the other hand, we also did a survey in NEDA and DOF. We did a total of 7 surveys at least. And this is what the people tell us, businessmen tell us. Number one, they want to also have tax relief. That is why we passed CREATE. And that tax relief is not only for this year, but forever, because those lower taxes are going to be for many, many years to come. Then we allow you to carry over your losses. Then number 2, the survey respondents also said that they want a deferment or grace period on the payments of various rentals, utility loans, and so on. And we did that. So in other words, we have to address the problem from that perspective, not only from one angle, but addressing a particular need of particular people. Thank you.
Yeah, Secretary, speaking of the 284 billion in the 2021 budget, there's a question here on, of course, for subsidies and assistance for those severely affected by the pandemic. There's a question here on how is this going to be given out?
Well, the 284 billion, as I understand, is provided to various sectors. So the biggest part is in DSWD for CCT, for distressed people in calamity areas, which includes pandemic areas. We also have money in DOLE for TUPAD or for various support to displaced workers. We have money in agriculture under the DA and so on. So all departments would have their own programs and their system to provide those subsidies and target them to those who are most in need. And on top of that, the government provided recently 22.9 billion peso in the NCR Plus area because they are unable to work.
Thank you very much.
Thank you.
We have a question from Francis Alan Angelo. Kayo, do you want to say your question verbally? France?
Yes, good afternoon, Secretary Chua and to Kayo Francis. Secretary, in a post-COVID-19 scenario, um, what could be the possible resilient sunshine industries that the Philippines could venture into, given the lessons that we have learned from this crisis?
Well, thank you for the question. We have a report in NEDA, We Recover as One report, that tries to explain this new normal. And although we would never know what the future would be, we have some ideas on how work and business would have to be conducted. And that would mean minimizing, if we can, face-to-face interaction. So in that report, there's a heavy premium on anything that can be done digitally. There's also a heavy premium on all the health services that we need. There's also a heavy premium on having more food security, so that at any given time, we are assured that we have food on the table. And food security does not mean you produce all the food you want, because you can produce it at extremely high cost and no one can buy it. When other countries sell rice cheaper, food security means we have an open market so that we can find the best and cheapest high quality food available. So those are some examples, which we think are crucial in this new normal. Thank you.
Thank you, po.
Thank you. We are still open for questions. And while waiting for the rest of the any hands raising? Wala. Yeah, speaking of ECQ, MCQ, GCQ, the alternating cycle of this process of making this announcement is actually affecting the economy. I think the graph and the charts that was provided to us by the secretary shows this. The question is, should the government be pouring its finances on building the capacity of our health system, like field hospitals? I understand in Manila there's not enough beds, the importance of ventilators, and the incentives for health workers. Parang it's a cycle na, secretary, na I think the most of the investments that we need to have is in the area of health systems capacity improvement. What do you say about this?
Well, that is in fact one of the highest priority in the budget. But I'll tell you this, everyone, the money is not the only solution. The problem we have here right now in Metro Manila, as I understand from DOH, is the healthcare workers. We may have the money to buy the ICU equipment and the rooms, but healthcare workers are limited. So, and we also have to prioritize the use of these scarce rooms. I understand also there are many mild cases in the hospital. The hospital space are limited, but if there are so many mild cases and they should be in isolation centers or resting at home, then we will have a mismatch. So we will ensure that we have the resources, but we also need the complementary HR and also the understanding of the people that we have to triage and prioritize our scarce resources. Thank you.
Thank you for that, Secretary. There's another question. Maybe I can read this. Of course, the Secretary has been telling us a lot of stories, good stories. But we also heard stories of people or poor people being required, like the boatman, the fisher folks, that they're required to go online to be able to apply and benefit from the subsidies. How can the government, improve the process of delivering these kinds of subsidies to, especially to those who are not connected online?
As to that question, if there is a particular LGU that is doing that, please let me know. I will ask the ILG to take a look. I don't think we should be, at this point, requiring additional documents or processes. But on the government side, we cannot just hand out money here and there. We have to account for that money. So sometimes to the extent we can, we have to abide by certain systems, which should not burden the people. The permanent solution to that is the national ID.
System. Yeah.
And as of today, 27 million have already registered for step 1, which is the biometrics. By early May, we will begin the online registration of step 1. So all of you, by early May, please visit the website of the national ID and register, because we want to get to 50 to 70 million by the end of the year. And once I have a registry of all of you, it will be far easier for me or the government to give money directly or the subsidies directly to those who are in need. Thank you.
Yeah. Any other question from our participants? Okay, we have one from Maria Luisa Segovia. Maris, can you verbally present your question? Maris?
But anyway, I can read the question.
Yeah, sige, Secretary.
Yeah, and everyone can just go to the chat and read the question so I can answer directly.
Okay.
Ideally, we would like to produce all the food we want. But in reality, like rice, you cannot produce that if you don't have full comparative advantage. In other words, if you try to produce rice when you have a mountainous region, you have typhoons 20 times a year, when you don't have natural irrigation, when you have land inequity, and so on, then the product is a very expensive rice. And you don't want to force 110 million people to buy expensive rice. Prior to rice tariffication, we pay double than Thailand or Vietnam for rice. So in reality, many provinces also have comparative advantage and they need the support of the government. So what we did in rice tariffication is we opened up the market, we allow importation because we want cheaper and higher quality rice. And I'm sure all of you eat rice every day and you don't want to pay the most expensive rice. But to balance that and help the farmers, all the tariff, we give it to the farmers to be more competitive. And I think that is how we should do our agriculture policy. The same for pork and so on. Number 2, we are working to individualize the collective certificate of land ownership awards, because there is no sense in giving property rights security to farmers if they don't know what part of the land they own. Because when they were given land through agrarian reform, they were given a collective title. Now we are working to individualize that so that they have property rights. Once they have property rights, we can do consolidation, not necessarily of ownership, but of management, because that's how you improve economy of scale and productivity. The idea of a romanticized farming where the farmer is on the carabao and pulling the arado is not going to give us food cheap and of high yield. We have to rethink the way we do, and we have to mechanize actually. Thank you.
We have additional questions, Secretary, in the chat box. Maybe you can respond to that. Also.
Yes, thank you. I can read. On the vaccine, I have to check with our vaccine czar, Secretary Galvez. Unfortunately, I'm not a dictionary or encyclopedia with all the answers. So I will check and hopefully have my staff in Region 6, the NRO 6. We have a regional office in NEDA to get back on you on the answer. Thank you.
Thank you, Secretary. I just received some questions. Actually, it's from the members. I noticed in your first slide, Secretary, about the Ambition 2040, that the GNI by 2020 is $3,966, and in 2040, The GNI is 12,376. This is part of your targets for Ambition 2040. Has this changed because of COVID-19 pandemic?
No, it has
It's
not
still the
changed.
same.
Same, because as I also mentioned, we had a head start. We were able to reduce poverty 4 years ahead of schedule.
Okay.
And our upper middle income country, we were about to get it in 2020 prior to COVID. So we have a head start. And I'm hoping by middle of next year, we will have recovered to pre-pandemic level. And that will keep us on track. But you have to help me, all of you, because, we have to work together. Your health is your primary responsibility. We have to maintain some personal discipline, each one of us, so that we don't overwhelm the hospitals. If the government has a quarantine, curfew, or social distancing, and if all of us individuals don't follow, then we will prolong the problem. So we will all have to contribute and help each other.
And I'm sure I captured it correctly that Secretary Chua was saying that the government is listening, right? In your
Yes,
presentation.
always
Always
listening.
listening.
We have
Okay.
to help each other also.
And they're open for intelligent discussions. That's what the term you were using.
Well,
Anyway, there's
we are
another.
open. We're open for all types of discussion, but prefer intelligent ones, backed by data.
Okay, evidence-based. Yeah.
Yes.
There are a number of questions still in the chat box. Maybe I don't need to state it. From Iloilo Business Club, I think this is in the secretariat.
Okay.
Do you have an
bridge.
update on the status of the Panay Negros Bridge?
Okay, the bridge is very important. It is part of our flagship projects. Unfortunately, we had a change of plan from Chinese to Korean, as far as I understand, and you must have known. The Koreans reviewed the feasibility study done by the Chinese. It was submitted to DPWH, and DPWH submitted partial requirements to NEDA just last March 31. And we are waiting for the remaining requirements. And we are hoping that we can do the evaluation in the next week. And we will update you on this.
Okay.
The next question is
Yeah.
elaborate more on FIST and guide. Okay, if you are a businessman, you might run into two types of money problem. The first is liquidity. In other words, you have many assets, but you just don't have cash. The other problem is insolvency, meaning you have no capital and your assets are being diminished by your liabilities. So we offer two ways to support businessmen. The FIST, there's a long cut for that, but it basically means we help the banks dispose the bad assets and bad loans so that they don't eat up the capital requirement, so that the banks can lend more to you. That is FIST, and that is already law, and the banks are implementing that. Now, the problem is if we don't have FIST, the banks will have a lot of non-performing loans. If they have a lot of non-performing loans, they will not lend anymore to the businessmen. On the guide, this is a way for us to invest in strategically important firms that require capital infusion, not just borrowing. So that is a difference. And guide is still in the Senate waiting for approval. Okay, from the LGU.
City. He
The
just
mayor said thank you. Thank you very much, Mayor. Thank you also.
Yeah. Thank you.
I've not visited your city. I hope to visit it one day after the pandemic.
Maybe you can also visit virtually.
Yes, I can do that.
Yeah, sige. Okay. There's I have a number of questions here also, Secretary. There are very specific questions like for example, I think the challenge for addressing the pandemic, COVID-19 pandemic, is actually a strong national and local coordination and relationships. So one question here is following the revival of the 2018 Supreme Court decision on by petition made by by governors Mandanas and Garcia regarding the increase in the IRA share of the LGUs, resulting to actually limited fiscal space for national budget. How do you think, how prepared are the LGUs across the board for managing this increased fund? And is there some sort of a system of prioritizing in assisting LGUs? And how do you monitor LGUs' performance in this regard?
Well, first of all, this is not a sudden development. We had 2 years to prepare. And I hope all the LGUs, with the help of NEDA, because one of NEDA's mandate is to help LGUs improve the planning process and how you use this additional money better. And I understand there will be several functions that will be devolved because you don't get additional money and do nothing. You get additional money with additional responsibilities. So the NEDA, the DBM, will be working closely with the especially NEDA through the RDCs and our regional offices to also help LGUs plan better. I think the DBM will issue guidelines soon on this matter. Thank you.
Thank you, Secretary. We have a question from Nars Lim, who is raising her hand. Ma'am Nars,
Yes, good
please go
afternoon,
ahead.
Secretary
Good
Chua.
afternoon.
I'm Narzalina Lim, former chairman of the Iloilo Economic Development Foundation. 2 questions. One is on the bridge. I read a letter from Secretary Simatu addressed to Secretary Villar asking for a copy of the environmental impact assessment of that bridge because apparently the endpoint will be affecting a large area of wetlands in the Negros area. So I'm wondering whether in your Build program, the environment is costed in as a big factor. I say this because there is a Coron-Culion bridge, which has been given a notice to proceed, which has not passed any environmental scrutiny. And the notice to proceed has already, the work has started. The backfilling of very sensitive marine protected areas has started. So can you please guide us on where the environment and sustainability of that environment plays in your Build program? Thank you.
Thank you very much. This boils down to the second or third slide. Everything is a trade-off. You want a bridge, it doesn't come free. We have to balance that with the environment and with the money and the impact on the people. Now, environmental assessment is mandatory in all these projects. I will get back to you on where we stand on that. In fact, all projects will have to be also get an endorsement from the Regional Development Council to ensure that there is a widest possible consultation. So I will get back to you on the status of that environmental assessment. Now, when the proponent submits a feasibility study, that is also covered.
Thank you.
And we cannot even start construction without getting that environmental clearance certificate.
Well, I know we're talking about Western Visayas here, but I am very concerned about the environment in Coron, Palawan, because it is a very important tourism destination, and you will affect fishing grounds and marine protected areas.
Thank you. I will get back to you also. I will discuss it with my regional office in Mimaropa.
Thank you.
Thank you. I will ask my staff to take note of all the pending ones and to gather answers that we can share with you.
Thank you, Secretary.
Thank you very much.
Thank you, Ma'am Nars and Secretary Chua. We can accommodate 2 more questions because we're running out of time actually. Yeah. Maybe I can read one last question in the list that was provided to me. Okay, let me check. Okay. Iloilo actually is actually city basically, and the province is a regional cultural capital of the country. A regional cultural heritage and arts council was recently organized by our NEDA RDC 6 to oversee the region's culture, heritage, and arts agenda, especially in relation to our regional development. How should we transition culture, heritage, and arts discussion to make it more relevant amidst pandemic? Secretary, would you like to respond to this question?
Well, thank you for the question. Actually, in NEDA, because we are the National Economic and Development Authority, some people expect us to answer all questions. But for this particular one, I'm not an expert on this topic, but I can tell you two things. Number one, in the Philippine Development Plan, culture is one of the chapters. And we only give a chapter if we find the topic of great relevance. And in this country with a very rich culture and diverse culture, it is to be promoted. And we have I invite you, in the interest of time, to look at the PDP chapter on culture for some of the priority programs that we are proposing. I will also request our NRO6 to also discuss with your group on some ideas that you find worthy to elevate to the national attention. Now, the second one is, a big part of our priority is tourism. Once our pandemic is over, hopefully, and we have addressed those, tourism, I expect them to come back. And they are not only after the nice beaches, they're also after the nice food, the nice tradition, and so on. So I would suggest that all regions like yours have an integrated plan so that you attract and maximize the potential of tourism to your area. Thank you.
Last pahabol, Secretary. There's a question from our Vice President of IBC, Terence Oigonco. He was asking about what is the revised GDP for 2021 considering the ACQs in NCR+.
Okay, the target is 6.5 to 7.5%. Because of the 2-week ECQ, we may see it reduced by 0.8. But I'll tell you, this is too early to make conclusions because we can still catch up. If it were November already, then I'll be certain of the reduction. But this is still too early. We still have in our hands actions that we can do to catch up.
With that, I think I would like to thank everyone who participated in our open forum. And once again, we wish to extend our deepest gratitude to our esteemed speaker, Secretary Carl Chua. Your presentation, I feel good about it. And the responses to our questions are greatly appreciated. And we hope to work with you again in the future through, of course, your regional offices. We would also like to thank our partners, the Daily Guardian, and of course, Global Business Power Corporation. Thank you also to our dear attendees again for your time and participation. We had really, I think we have 57 to 60 attendees via Zoom, and we have not identified how many viewers via our Facebook Live. To those who weren't able to catch up with this webinar, we shall be, I think there's a live stream that we had done, and maybe you can opt to rewatch this entire webinar. We would like you to sign up with the Daily Guardian by visiting their Facebook and social media accounts. I think there are news about this webinar and the past webinars we have done. And stay updated. Take on the latest news and make sure that we are updated about the current developments in the region. Again, I am Francis Santoral, and this has been a productive episode of the Iloilo Business Online, brought to you by Iloilo Business Club and the Daily Guardian. Thank you very much and have a good day, everyone. See you in the next webinar.
Thank you very much, everyone.
Thank you, Sec. Thank you.
Thank you.